Dr. Omar Marar, Maryland, a respected colon and rectal surgeon and educator, works in a field where surgical precision directly influences recovery and survival. In colorectal surgery, maintaining anastomotic integrity, the strength of a surgically created intestinal connection, remains one of the most critical determinants of patient outcomes. Preventing anastomotic leaks is not simply a technical task, but a comprehensive process that combines patient optimization, surgical accuracy, and vigilant post-operative care. A single leak can turn an otherwise routine operation into a life-threatening complication. Effective prevention lies at the intersection of surgical science, physiology, and ongoing innovation. An anastomosis represents both the culmination and the most vulnerable step of colorectal surgery. When failure occurs, it can lead to peritonitis, sepsis, prolonged hospitalization, and increased mortality. Despite advances in minimally invasive techniques and enhanced recovery pathways, anastomotic healing remains dependent on delicate biological processes influenced by blood supply, tissue handling, tension, and local inflammation. Leak development is multifactorial. Poor perfusion, excessive tension, malnutrition, steroid use, diabetes, smoking, and prior radiation exposure all impair healing. The intestinal microbiome also plays a role, as certain bacteria can interfere with collagen synthesis and weaken tissue strength. Technical errors, including inadequate vascular supply or misaligned tissue edges, further increase risk. A secure anastomosis begins long before the stapler is fired, says Dr. Marar. Optimizing nutrition, controlling chronic conditions, and addressing risk factors before surgery are essential foundations for success. Preoperative planning is critical. Modern imaging and intraoperative tools such as fluorescence angiography allow surgeons to assess blood flow in real time, ensuring that both sides of the anastomosis are well perfused. This technology has significantly reduced leak rates by enabling objective decision-making during surgery. Mechanical stability is equally important. Excessive tension disrupts microcirculation and delays healing. Proper mobilization of the bowel and careful alignment of tissue ensure that the anastomosis heals under physiologic conditions. Stapled and hand-sewn techniques each have advantages, and experienced surgeons select the method best suited to the anatomy and disease involved. The priority remains precise alignment, gentle tissue handling, and preservation of blood supply. Modern colorectal surgery integrates multiple safeguards to reduce leak risk. Intraoperative air leak testing, reinforcement materials in high-risk patients, and advanced visualization platforms all contribute to safer outcomes. Minimally invasive approaches, including laparoscopic and robotic surgery, enhance precision, reduce tissue trauma, and improve healing by preserving microvascular flow. Technology doesn't replace judgment, Dr. Marar notes. It strengthens it by allowing us to identify and correct problems before they become clinical failures. Post-operative vigilance is just as vital as operative technique. Early detection of leaks dramatically improves outcomes. Monitoring inflammatory markers, such as C-reactive protein, along with close clinical observation, enables prompt intervention. Imaging confirms suspected leaks before catastrophic deterioration occurs. Collaborative care plays a central role in prevention. Nutritionists, anesthesiologists, nurses, and surgeons work together to optimize recovery. Enhanced recovery. After surgery, protocols standardize fluid management, pain control, and early mobilization, indirectly supporting stronger anastomotic healing. Patient education further improves outcomes by encouraging early reporting of warning signs. The future of anastomotic integrity lies in personalization and precision. Advances in tissue engineering, smart sutures, microbiome research, and AI-driven monitoring promise earlier risk detection and tailored interventions. Yet the fundamentals remain unchanged. Respect for tissue, meticulous technique, thoughtful preparation, and continuous learning remain the strongest safeguards against anastomotic failure.